Hello, I'm Frederica Granger, Community Services Manager for Rockville's Department of Housing and Community Development. On behalf of Rockville's Mayor and Council and the City, I want to welcome you to the Rockville Goes Purple Opioids Let's Talk About It panel discussion. The Rockville Mayor and Council have proclaimed September as National Recovery Month. And throughout the month of September, as part of the Rockville Goes Purple opioid awareness campaign, the city is holding several events like this to highlight the impact and dangers of opioid addiction. This year's theme, Opioids, Let's Talk About It. We want to encourage an open and honest dialogue about the problems of opioid addiction and to bring awareness about the dangers of stigmatizing its addiction. One can become addicted as a result of taking opioids for illness or injury to physical or mental health. And right here, right now, is where we start to shed that stigma by having that open and honest conversation about the prevention, recovery, and education of opioid addiction. We're joined by 6 extraordinary people with a wealth of knowledge about the prevention, education, support for opioid addiction, and even a Rockville resident whose journey of recovery will inspire. So let's get into it. Let's start with introducing our panel. We will start with Judge Dwyer. Judge, could you introduce yourself?
Hello there, everyone. My name is Deborah Dwyer, and I'm a judge here on the Circuit Court in Montgomery County. I am one of 4 judges who preside over our adult drug court program, which is a collaborative partnership between the Montgomery County Circuit Court, the State's Attorney's Office, our Public Defender's Office, various law enforcement agencies, our local health treatment system, parole and probation, and other program participants designed to end the cycle of addiction that leads to crime. In the drug court's 17-year history, we have seen 244 individuals, many of them with extensive criminal histories, and all of them with substance addictions, enter recovery and graduate from our program. I'm happy to be here tonight.
Thank you. Mr. Stevenson.
Hello, everyone. Ben Stevenson II. I'm with Montgomery County Department of Health and Human Services. I am housed within the Local Behavioral Health Authority, and I am the Prevention and Harm Reduction Manager for the county. So I oversee a lot of our prevention, education, and awareness efforts on related to substance use disorder, as well as suicide prevention. I also oversee quite a bit of our harm reduction efforts in the county, which includes our Narcan training program, also our syringe services program, and our fentanyl test strip distribution efforts. So happy to be with you today.
Thank you. Dr. Bone.
Hi, my name is Dr. Ashley Bone. I'm the chair of psychiatry at Suburban Hospital, Johns Hopkins Medicine Hospital. I help oversee and run services here at Suburban under the Department of Psychiatry, which include inpatient mental health services as well as detox services. I also help to oversee and see patients myself on the medical and surgical inpatient units for psychiatric consultation as well as detox services. In addition to that, I also help with Beth Kane Davidson out at the Addiction Treatment Center for our intensive outpatient substance use program.
Ms. Davidson.
Thank you. My name is Beth Kane Davidson, and I'm the director of the Outpatient Addiction Treatment Program at Suburban Hospital, Johns Hopkins Medicine.
Mr. Burton.
Hi, my name is Ryan Burton. I am Clinical Outreach Ambassador for Sandstone Care. We are age-specific substance use disorder treatment, both inpatient and outpatient, typically around 13 to 30, working with adolescents and young adults.
Thank you. And Mr. Feldman.
Hi, I'm Scott Feldman. My mother and I started Giuseppe's Pizza in Rockville Town Center 31 years ago. Due to a genetic back injury, I was on prescribed opioids for 7 years. I was on opioids. I was on fentanyl, and by association, I became an opioid addict. And thankfully, I'm here to speak to you today, and I'm very active in the Montgomery County opioid recovery
community.
Thank you. Yeah, community. and I'm always available to those in the addiction community. And I'm glad to be here with you.
Thank you. Thank you, Mr. Feldman. Thanks to everyone and welcome. The COVID-19 pandemic affects all of us in ways that we are still trying to process, and we continue to suffer from the COVID pandemic. But imagine dealing with an opioid addiction during the time when the entire world has hit the pause button. Let's talk about it. Scott, I'll start with you. Mr. Feldman, first, your story of recovery is truly inspiring. I can only imagine how hard it was staying on that path of recovery during the pandemic. Can you talk about your recovery journey and tell us how you were dealing with it, during the pandemic, especially as a business owner?
Absolutely. The pandemic made it, first of all, it's one thing I speak to all the time to people in recovery, and it's so important. It's a day-to-day battle, and I talk about it every day. Every day is a new day in recovery. And first and foremost, I want to thank the mayor and council of Rockville for having this program and showing so much concern for such an ongoing and terribly and often ignored, there's the pandemic and this is an epidemic, and it's often so overlooked. And education and information and platforms such as this are so important. This is a disease. I guess that's the best way to put it. And it's so often overlooked. And education is so important. And the problem is that people that suffer from the disease, like I do, and I always will, are not often in the position to take it upon themselves to get treatment and to seek treatment. And so I guess right now, people that are going to watch this program are oftentimes family members. And in my situation, it was so important that I wasn't in the position at the time to go and seek treatment myself. It was so important that my family interceded and sought the intervention to get me on the path of treatment, because I was in such denial at the time that it finally took their intervention to intercede to get me into that path. And yes, and the pandemic made it so much worse. And that was such a great point that you brought up, because all the AA meetings and the NA meetings and so forth, the pandemic obviously took so many people down, as it was, but the support systems that were in place for so many of us, the meetings and so forth, ceased to exist, that it made it that much harder. I mean, thank God, we had the Zoom meetings and so forth, but the contact, the in-place contact for people in the recovery community is so important. The support systems that were in place that are so important to people such as myself, that ceased to exist. Were so important. I mean, obviously, information and education is so important to people such as us, because people in recovery, I mean, let's face it, we're not at our best. And these meetings and the support systems that exist for us are so important. The counseling and so forth, the person-to-person contact, they're so important to us. Phone calls and internet and all that, they're good and they're important. But the in-person contact that was removed from us, I mean, obviously the numbers and the statistics that you saw that went up parallel to the deaths that took place during COVID. I mean, they paralleled just like COVID deaths went up. I mean, numbers don't lie.
Yeah, what Scott will talk about, like all that, how everyone had to pivot to find services that would help them during the pandemic. And you raise a good point about Zoom meetings and, WebEx meetings.
That's right.
And all the, and it's scary because of what happened.
It is. It's terrible. And look, I'm grateful. I mean, honest to God, I mean, I'm humbled by it. But this whole thing took a lot of good people down. There were so many people that I went to recovery with.
Yeah.
And I stayed in touch with, and I mean, a lot of good people. And like I spoke to before, to the point that it's a disease just like any other. And this is why education is so important. And it crosses all boundaries. It crosses just like any other terrible disease, be it race, socioeconomic, ethnicity. It doesn't pick by any.
Okay, Judge Dwyer. Judge Dwyer wants to respond to that. Yeah, you're right. It absolutely does. It doesn't pick any certain people. It doesn't, it doesn't leave anybody out. It doesn't address people just with physical illness. It addresses people with mental illness. It's a sad thing. I mean, and also it can have quite a hold on you. And we're going to ask Judge Dwyer, if she could talk about the opioid addiction's hold on people, because she works with the criminal justice system. Crime's unfortunate. It's an unfortunate consequence. So Judge Dwyer, could you speak to that?
Yeah, I'd be happy to speak to that. And one of the things I just wanted to say in response to Scott is a couple of the things he talked about, or this concept of addiction being a disease. And, we talk about that so much in drug court. It is a disease, and it finally getting to a point where it is being treated like a disease. The other thing Scott mentioned was the support system and this person-to-person contact. We rely on that so heavily in drug court. We were so afraid during the pandemic that drug court was going to suffer. And we managed to never miss a court date. We meet every Thursday. We never missed a court date. We did everything by Zoom. And, it was a struggle for us, though. We saw some of our clients regressing during that period. And it's really important to remember, how the COVID impacted all of us, obviously, but it's so important to remember how it impacted those who need that support system, that person-to-person contact to help them through this disease. And, it's widely known that some criminal behaviors are the direct result of addiction. And we have known that for decades. We have seen a significant increase in criminal behaviors related to opioid addiction in this county. Unless the addiction is recognized and treated, the cycle of criminal behavior is likely to be repeated. Our adult drug court program seeks to reduce recidivism by giving offenders an opportunity to address and treat their addiction through our intensive services and our supervision that's designed to address substance dependence and its relationship to criminal thinking. The success of our program is tied to the success of participants being able to sustain a crime-free and sober life. And so we feel like if we can reduce addicted offenders' criminal activity, then we automatically increase public safety. And so That's a win-win for everyone in our community. And it starts with recognizing that link between addiction and criminal behaviors.
Wow, thank you. Thank you for that. One of the goals of the Rockville Goes Purple campaign is to provide the resources to those who want and need the help to get onto the road to recovery. Ben, Beth, Ryan, and even Judge Dwyer, all of you have and are dealing with people who are either seeking help or recovering from addiction, and all of you, as well as Scott, are recovery advocates. I'd like to talk about how each of your organizations or groups has helped those who suffer from the opioid addiction. Ryan, I'm going to start with you.
Thanks. So I think, especially right now in the pandemic, as we've seen, a lot of people were at home. We're seeing more access to people getting into, let's say, their parents' medicine cabinets, more access to being at home for sustained periods of time. So we're essentially seeing, this increase across the board, not only in mental health, but also in people that are kind of leaning on substances. And it ties in with our first question, which we were talking about stigma. A lot of times we see it as like a poor life choice, right? We see it as a like a mistake or that they've fallen on bad times, but really it's a coping mechanism. So we've been in this terrible event where we're not seeing people. And I think when we're going through, what we can do for people that are suffering, I think the biggest thing is that, you're trying to find a solution for those people when they're reaching out. And I think that's what the majority of the people on this call do and are involved with, is that you're able to kind of direct those people to something that they need, what level of support they're looking for. And I think it's really just again, I speak. I think everybody on this is on the same page, where it's a commitment to your community, and you're really it's just like Scott shared. You're trying to be a resource for those people in a time of need. So it's something that, again, with virtual, we didn't really have that in-person connection, right? That's the struggle. And I think the opposite of addiction is not sobriety. It's connection. So we're always looking to build that, and that's something that's really hard to obtain. So during this.
Yeah. Thank you, Ryan. Dr. Bone, did you say you wanted to say something about this?
Yes, thank you. I just appreciate what everyone has mentioned already, but I did want to address that we certainly here in the hospital have seen, even before the pandemic, we see a lot of comorbid addiction issues as well as mental health issues, and we're really trying to assess what needs to be treated. Sometimes it's not very clear. Sometimes we need to kind of sift through if the addiction were treated, does the person also need some other mental health treatment for comorbid mood disorders or some other kind of psychiatric illness? We know that increases addictive behavior, not in everyone, but in a certain population of people. So we are certainly trying to sift those out so that we can support people and really help them succeed in their recoveries. We see people, certainly during the pandemic, we've actually seen the severity of addiction really escalate. There have been, in Montgomery County, I know, at least a 25% increase in overdoses in Montgomery County during the pandemic. And it's been pretty devastating. We've seen intentional overdoses as well as unintentional overdoses. We also, what we typically see in the hospital is we see people who are really struggling with the devastations of their addiction disease. We see it affect relationships. We see it affect their housing situations. We see it affect their employment. And we see people coming in often quite desperate, quite devastated, and some of them to the point of even not wanting to live anymore. So yes, we try and offer resources if they need inpatient hospitalization to do that, and if not, trying to link them up to the appropriate support and services outside of the hospital.
Yeah, so what you're saying is it takes hold of their entire life, and it puts someone in a desperate situation. Ben, did you have something you want to say to that?
Sure. So, I mean, in regards of my program, we try to basically meet people where they are, and assist them in the best way that we can, as well as the family in a whole. So as far as harm reduction, I know we've made a lot of effort in regards of trying to get Narcan into the hands of people who actually need it. So the people who are actually struggling with their use, as well as their family members. So the county has made an effort of trying to saturate the community with Narcan, not only training those users, but also their family members, getting Narcan in the hands of local businesses. For instances, if someone overdoses in like a bathroom or something like that. So just trying to ensure that we get Narcan in the hands of the people that need them. But I will also say, just ensuring that just, I know Scott and everyone's kind of alluded to talking about the whole connectedness and thing like that. And so I know as far as Narcan, we had to basically pivot with that service by providing it online. And so everything is pretty much automated now, where a person could actually come online, do a 30, 45-minute training, and we can actually mail a kit to your home, to you. So we've been approved by the state to actually do that. And then if a person wants to actually get that face-to-face contact, like Scott said, then they can actually meet up with one of my staff members to actually get a kit as well. And then we've also tried to get kits in the hands of different treatment providers. So I know we've delivered kits to Beth and her team, and as well as other treatment providers in the county, as well as fentanyl test strips, so that a person who is actually struggling with use can actually test their substance before they use it to see if it's laced with fentanyl. So just to try to, we're trying to prevent these overdoses, to hopefully, build a bridge and build relationships to help hopefully lead people to the path of pursuing their treatment and recovery.
Thank you. Thank you. Beth, did you want to comment on any of that?
I just wanted to say that, Suburban's been doing addiction treatment since 1983, and we have dealt with these trends that have come up, epidemics. In 1986, I might be dating myself, we dealt with the cocaine epidemic, and we had to come up with added services. It's kind of like what we're doing now with this devastating epidemic, is we're trying to come up with what can we add. For the cocaine epidemic, we added a cocaine nightline that was staffed midnight to 7 a.m. because that's when people were vulnerable. One of the things that I think is so, good with the services we're providing is what, Ben just talked about, the Narcan training, Narcan kits, making those available. But also we have instituted peer recovery coaches. So we have peer recovery coaches in our emergency room to try to help people engage in treatment. They work side by side with the staff. We've added groups at our outpatient program, like, recovery enhancement groups. And I also want to just point out on the other side, a sad side, we host a support group for moms that have lost their children. It's called SOUL, Surviving Our Ultimate Loss. And so how I see it is this epidemic is making us have to reach out to all aspects, patient, family, community members, media, everything we can think of to just keep adding and improving our services.
Yeah, thank you. Thank you. We're going to move on to the next question. So we've talked a lot about resources. I'm knowing that there are these resources available for those. So for those who are dealing with opioid addiction and have a family or have a family member or a friend dealing with this addiction, it's crucial to know that these resources are available in order to lead a healthy life. I know Scott has said and others have said it's a pathway to death just if you're staying on opioids. So my next topic I'd like to tackle is how or what is the first step to start in this journey of recovery? Is it therapy? Is it coping skills? Is it seeing your doctor? Scott, what was your first step of recovery?
First of all, my script is, everybody's script is different, okay? What works for me is not necessarily what's going to work for somebody else. The most important thing is called surrendering to the devil, or the demon, I guess you would call it. The demon being the
admitting you need help. Yeah.
The drug. Because here's the problem. Somebody suffering from it, and this is a common thread, is often in denial. They're often lying about it. They're lying to their family. They're lying to themselves. That's like, hey, I got it. I'm under control. It's no big deal. I'm going to work every day. I'm driving straight down the road. I didn't get pulled over yet. I didn't get a DUI. Okay, I ran over a few curbs or whatever. There's all these things. For me, it was a family intervention, okay? For me, it took, for me, it was fear of loss when it got to the point where realizing what was at stake, that all of a sudden my wife and my children confronted me, and it was like, either you go into recovery or it's either this or that. You have A or B.
Yeah.
And
well, I like
that. You have to choose. You're either going into recovery or we're out of here. Okay. So for me, it was fear of loss, but that's what it was for me. Some people end up in the gutter, and they, because when I was in recovery,
Scott, I'm going to interrupt you.
Different stories from other people.
Yeah, I'm going to interrupt you again, and I'm going to ask Dr. Bone, and then Judge Dwyer about what they've seen about the people who had different surrendering opportunities, I guess you would say. So, Dr. Bone.
So I absolutely agree with Scott that there are definitely several different paths to recovery. The one thing that I think unifies all of them is that I really haven't successfully seen anyone do it alone. I just haven't seen that work. What I've noticed is, sometimes people need to be physically removed from their environment, which might include inpatient rehab in order to get a little bit of time under their belt, a little bit of sober time and out of their environment. I've noticed that medically, some people need to be medically detoxed first. They get so sick that it's unbearable, and they really need some medical attention in order to get medically detoxed first. There are other services such as intensive outpatient programs and intensive services outside of the hospital, like the Addiction Treatment Center here. Other people, we very much recommend 12-step meetings to people, and that's very much a part of people's recovery, usually. But there is also the option for some people wanting to do medication-assisted treatment, which is something that's longer term that can help them to really kind of curb cravings. Most of the time when we're recommending that, it's in addition to other kinds of services. So medication-assisted treatment, in addition to therapy, and 12-step meetings is usually really the most helpful. So we kind of, it takes a village. So we kind of try and wrap it all together.
And each person's unique, just like Scott said, each person has a different menu, or not menu, but treatment plan, I should say. Judge Dwyer?
Yeah, thank you. I wanted to just say that it has been said at meetings, 12-step meetings across the country and across the world, that addiction is a cunning and baffling disease. And no one takes the same path to addiction, and no one takes the same path toward recovery. Dr. Bone said it best. Recovery is not done alone, and our drug court clients know that very, very well. We use a whole variety of treatment options to address them as individuals because of the baffling nature of the disease of addiction. We use medically assisted treatment. We use intensive outpatient treatment. We use the 12-step program. We use sober housing. So there's a whole variety of options that are available. But the one thing that I agree with Dr. Bone and Scott overwhelmingly is that no one person gets on the path of addiction in the same way, and no one can be treated the same way. But the one thing that everyone has in common is it has to be, it can't be done alone. It has to be done with peer-to-peer contact and with a whole variety of treatment options. And we're trying to provide that in our adult drug court program. And we've seen a lot of success with it.
Yeah, it sounds very impressive. Wow. So lastly, I want to talk about what loved ones can do. So Scott had mentioned, the addict, the person who's suffering from addiction, has to surrender, but what if the loved one feels stuck? What's some advice you can give to those who know someone who's, or they're trying to help that person? What can they do to sort of move things along to help them? Beth, I'll start with you.
Thank you. Well, number one, don't give up, and also get help for yourself. I mean, it's already been mentioned that this is a disease. It's chronic, it's progressive, meaning that it's going to get worse over time if not treated. So it's not only getting worse for the patient, but it's getting worse for the loved ones that are around that person. So first and foremost, learn about it being a disease and acknowledge that. And acknowledge that even if the person is in recovery and you start to notice behavior that's making you feel a little anxious, acknowledge that. Don't, keep your eyes closed. Learn about the task of the family. Learn about, is this enabling behavior I'm doing, or is it provoking? Try to be compassionate, but reach out to other people to support you. Suburban has a concerned persons program that is free. It's weekly. It helps people understand what the task of recovery are, what they can do to help their loved one. I think it's been said over and over again, this is fatal and we have to get in front of it.
Yeah, and it's a community of concerned persons too, at the Al-Anon meetings, at the meetings you're talking about. Ryan, what is your experience with this?
I share a lot of the same things that Beth said. Is essentially, you know, one of the biggest things is if you're looking for help for someone else, you know, everyone is affected indirectly through that. So for me, I think we see that a lot in the families that you're working with, right? There's a lot of pain, there's a lot of suffering. It's not just the person that's suffering from addiction, but it's everyone in that entire family unit. And I think sometimes that's a hard thing. And I say this is in the kindest way that not always do parents want to engage in help or want to seek some help for themselves. And I think I always tell people is you know, very similar to when a car is in an accident, they don't just fix the first, you know, like the front tire, it's the whole car. So really, I think, again, finding help for yourself. And then I think also it's just kind of starting that education and kind of understanding more of it, understanding it's not those poor choices. There's a lot of options out there. I will say that the benefit that has come from this pandemic is that we have a lot more access to virtual resources that we didn't have before. There's tons of free, you know, family groups. We do a parents like a parent support group. There's Hazelden does one. There's all these different resources out there, and I think anybody on this call you could lean on for some of those resources as well. But yeah.
Yeah, and I always think in my work is focusing on the person's strengths. I mean, wow, there are tons of strengths a person has. Ben, can you comment on this?
Yeah, so we do a lot of trying to, you know, connect people as well with different, you know, referring out to different services for families and also for individuals. But I mean, we also have a program in the county called STEER, which is Stop, Triage, Engage, Educate, and Rehabilitate, which is a group of peer recovery specialists that are actually deployed out when an actual overdose actually happens in the county. And so those peers actually try to engage with either with the family as well as with the patient, to not only provide them with some supports, but also, you know, provide them with different education and referral sources and things like that. But even after that incident happens, they try to stay engaged with the client and the family, just to, you know, build a rapport with that client to hopefully lead them to a path of recovery. And then in 2016, the Maryland passed a law which approved jurisdictions to provide syringe services programs. So that's something new that's actually happening in the county, which is kind of like an encapsulation between, you know, a person struggling and a person actually pursuing treatment. And hopefully it'll help, you know, lessen those issues that are associated with, you know, new HIV cases and experiencing overdoses and the sharing of needles and things like that. And so that program there is also an encapsulation to try to foster a relationship and build that and provide different supports to lead that person down a path of pursuing recovery and treatment as well. So there's an array of services and programs that are out there. And just like Ryan had indicated, a lot of things in this virtual space has opened the doors for a lot of us.
Thank you. Thank you, Ben. So we're kind of winding down, but before we go, I want to ask each person, each of the panelists to give, you know, what would you like to say in addition to what you've already said about this epidemic, about recovery, about services, anything you'd like to say about opioid recovery and the sort of hold addiction has. Dr. Bone, we'll start with you.
I think the main thing that I'd like to say is just that addiction is a very isolating disease. And there are a lot of resources available to people. I think sometimes it can be hard to get to them, but everyone here on this panel has access to resources to get people help. We know that there are several levels of help and people might want to engage in different ways, but there are several virtual and in person, different kinds of ways that we can engage people in different resources and services available to them so that we can help them recover.
Thank you. Beth, do you want to add to that?
Sure. I mean, I think we need to bring knowledge, prevention, and treatment into everybody's hands. I've been working in addiction since 1978, and I can tell you treatment is improving. But with this devastating opioid addiction, we need to bring all fronts to the table. And I think that one thing we can focus on is these county resources we have. I mean, just go to the county website. Again, the Narcan training, the Narcan kits, the free services that are available for parents, families, how to help. I mean, this is something that we all have to come together on.
Yeah, and I always try and encourage people, you're not born an expert on opioid addiction. You need to access help from the experts. So Judge Dwyer, what are your final words?
Well, we are in an epidemic of addiction. There's no doubt about that. It is local, it is national, it is worldwide, and it is not a secret. But it is not hopeless. And I would invite all of you and anyone who is listening to this program to come and watch our adult drug court program. We meet every Thursday. It is open to the public. We are in the courthouse right here in Rockville, and you will be inspired and amazed by the success stories of our clients. It is the most amazing day to spend in this courthouse, and I am honored to be a part of it. Every session, I am inspired by our clients. They are struggling with addiction, but they are hopeful, and they should be hopeful. And I invite all of you to come and see what a tremendous program we have here in the circuit court, and the partnership we have with so many of our support services here in the county. I think you'll be inspired and amazed.
So anybody can come anytime.
Yes, we meet all day Thursday, every Thursday of every week. We have sessions at 11 o'clock. We have sessions at 4 o'clock, 5:30, and 6 o'clock. And they are all inspiring, and they bring us all hope. So I invite you to come and watch us.
Thank you. Thank you for that. I'll have to come. Ryan, do you have some final words?
I do. Yeah. Thank you. I think we touched on it a lot, but I think events like this are one of the biggest parts of changing that narrative. And really, all we're doing is identifying a lot of routes to help and support. Right. So even on this call, there's a lot of different people that you can reach out to, that you can turn to, and I think that's one of the biggest things that prevents people from reaching out, is that stigma that already exists around it. Right. Like the fact that you have a problem or that you are suffering. So it's really, when we're doing events like this and to be a part of it, we're helping to tear that down and normalize this. This is just like anything else that people experience. It's just, what you're experiencing in that moment, and hopefully you're able to find some solutions. So thank you.
Thank you. Ben, Mr. Stevenson.
Yeah, so my final thoughts is as far as language is concerned, I would say that one thing in regards to trying to lessen the stigma in regards of addiction is the changing in language, and how we refer to a person who is dealing with their disorder and things like that, versus calling them an addict. You would call them like a person that's dealing with a substance use disorder. So just, I think that's one important aspect of really lessening the stigma. But I will also say, if you are in the county and you are interested in accessing any of the services that the county has as far as harm reduction, so that's pursuing training to get Narcan, taking advantage of the syringe services program, which also provides free wound care and free HIV testing, clean syringes, different supplies and things like harm reduction supplies, fentanyl test strips, Narcan kits, and things like that. You can reach out to us. Our number is 240-777-1836. Also take advantage of the law enforcement and pharmacy ran safe and disposal boxes, prescription drug disposal boxes. We actually have about 15 in the county now. I remember at one point we had 0, so now we have 15. So please take advantage of those and dispose of all your unwanted and expired prescription medications. And then, also, as far as when it comes to fentanyl, I try to educate a lot of people about the dangers of fentanyl, just because since 2016, we've experienced over 60% of our fatal overdoses have been fentanyl related. And so we're currently in the process of doing a awareness campaign around the dangers of fentanyl. So you might see some PSAs on television, maybe on your digital devices, as well as you might see some bus ads as well. And those ads that you may see have QR codes connected to them, which if you scan the QR code, it'll send you right to all of our information. So please take advantage of that and find us, because we're definitely trying to connect with people who are struggling, as well as their families, to help in its best way we can.
Thank you. Yeah, it's one thing about the pandemic is it's taught us how to connect virtually to information, and it's also taught us that anyone and everyone can become addicted to opioids due to stress or because of physical illness. Scott, what are your final words?
First off, I'm glad I'm here because obviously I was down this terrible road, and my first like I said, I was on fentanyl, to Ben's point, and that was a horrible drug to get off, and the doctor, who will remain nameless, that put me on it, and that was before Prince and Tom Petty died, and it's terrible because until somebody famous dies from something, nobody knows about it. It's not in the forefront. But anyway, we're all on the same page here, and after everybody watches this program, I hope they get on our page. And the terrible thing is the first step in recovery is the hardest step. And I hope after seeing this program, people in an addiction try to attempt that first step. And I might get a little emotional here because I've been down this road, and I'm so grateful to be here. And I hope and I pray that people watch this and are affected by it, because I almost lost everything, and I'm here, and I have my life back, and I almost lost it all. And there needs to be more of these. There really does.
Well, we do
Because
have
life is a gift. It's really for all of you. And I can't sugarcoat this because it's not easy, because people that suffer from addiction are in the worst possible downward spiral, in the worst place in their lives. And I use this analogy a lot. If somebody in your family was suffering from some terrible disease, albeit heart disease, cancer, or whatever, you would not put them out you would not put them out. Addiction is a disease. They need your help. You got to help them. It's not easy, and it's terrible. But you got to be there for them. And they're not going to say, okay, you're right, I need your help. What do I got to do? It's really difficult, and they're in a terrible place. But if they don't get your help, like any other terrible disease, if they don't get into treatment, if they don't get help, all roads lead to death. There's no other way to put it. It is what it is.
Yeah, it's. I think Scott.
And like every other thing, when you go through recovery, like everybody else on the panel shared, whether it be a recovery center, whether it be NA meetings, 12-step programs, whatever, after that, when I speak to groups, I do a lot of speaking to recovery groups. After you go, if you have heart disease or whatever, you go for physical therapy. When you get out of recovery, it's the same course of treatment. What NA is the follow-up, and it's an ongoing thing. When you have this disease, it's a lifelong struggle. It's day to day. You have to stay in NA. The follow-up is part of the program. And I forget who it was, I'm sorry, that said, you have to look for signs. You can't have a comfort level that once they get out of treatment, they're cured. You're never cured. It's forever. You have to watch. You can't sit back and think it's all over with. You have to watch for signs, because there's this little thing called relapse, and there's these things called triggers, and you never know when that's going to occur, but it does. And you have to watch for that. If you love them, you always have to be on the lookout for it.
Well, thank you, Scott. That's a good way to close. I think it's our job as a community to help people manage those triggers, manage that relapse, to manage themselves, to have the best life they could. Thank you, everyone, for your honesty and your openness and just your candor. I think it's a really hard time right now with opioid addiction. It's a a hopeful time, as Judge Dwyer said, that there's so much out there that you've all communicated about for us to provide to folks who need it. So let's keep the conversation going. I mean, I really was reminded of, let's talk about it when you all were talking, and in Scott's candidness and just, you know, just raw material that you provided us to say that there's hope. So if you know someone who needs help, or if you need help with opioid addiction, there's support available to you on your journey to recovery. As you heard, there's just all this help here, and there's even more. This is only 6 folks. I mean, there's tons of resources in this area. There's a list of resources and support groups on your screen. Please take advantage. The Rockville Goes Purple campaign is an ongoing effort to bring awareness to the national impact of opioid addiction and to signal hope for recovery. Join us as Rockville Goes Purple to learn more about the campaign and upcoming events. All you need to do is go to RockvilleMD.gov/RockvilleGoesPurple. For all the panelists, the Rockville Mayor and Council, and the City of Rockville, I'm Frederica Granger. Thank you for joining us.